My name is Dr. Arthur Hartman. I am 63 years old, and I need to tell you something that has been eating at me for years. I know the moment I say it, some colleagues will be very upset, but after 2 decades in medicine, sitting in my clinic and watching what happens to people who follow every single medical recommendation, I cannot keep quiet anymore. I have a confession. I have ordered tests that ruined lives. Here is what nobody in my profession wants to admit. Sometimes the absolute worst thing you can do for your health is get too many tests, especially after 60. I can already hear you thinking, wait a minute, isn't this doctor supposed to tell me to get checked for everything? Isn't prevention the whole point? Yes, that is exactly what we have all been told. Catch it early, find it before it is a problem, and stay on top of everything. It's the message we hear everywhere. But I am telling you today that this message leaves out the most important part of the story. It leaves out what actually happens to your life after you find something. Let me explain what health screening commercials never mention. Once you find something, the wheels start turning. Even if it is something harmless, the medical machine takes over, and sometimes those wheels run right over your quality of life. I have watched it happen. Today I will walk you through 4 specific medical tests that I see causing far more problems than they solve for people over 60. I am not doing this to scare you away from doctors, but because I want you to understand exactly what you are signing up for before saying yes to every offered test. Before we get into specifics, I need you to understand a concept that changed how I practice medicine. It is called the cascade effect. Once you see it happening in real life, you cannot unsee it. Here is how the cascade works. My patient Thomas was 67 and came in for a screening test. He felt perfectly fine, living his life and playing with his grandkids. The test came back and showed a tiny spot. That spot might have been completely harmless, sitting there for 20 years, and would probably sit there for 20 more without ever bothering him. But here is the problem. I saw the spot on the report, and once a doctor sees it, we have to act. What if we don't, and it turns out to be serious? So, I sent Thomas to a specialist who ordered a more detailed test. That second test showed the exact same spot, but still wasn't clear. The specialist then told Thomas he needed a biopsy. This is a physical procedure that means cutting into the body, and each step has severe risks: infection, bleeding, physical complications, massive mental anxiety, and lost time. And here is the kicker. Thomas got the biopsy, got a bad infection from the needle, and ended up in the hospital for a week. He lost 10 pounds and was miserable. At the very end of all that suffering, we found out the spot was just a benign cyst. It was never going to hurt him. But he went through months of terrible worry, painful procedures, and a bad complication. He was much worse off than when he started, all because of a single test he got when he felt totally fine. That is the cascade effect, starting with a test you probably never needed. Let's talk about the first test causing this problem. This one is tricky because it sounds so modern and preventive: whole body scans. These full-body MRIs or CT scans promise to check everything in your body all at once. You have probably seen the ads saying, "Come in, we will scan you from head to toe and catch anything early." It sounds like getting a perfect picture of what is going on inside you. Honestly, I get it. The idea of having total control is incredibly appealing. But in the reality of my clinic, here is what happens. You are 65, active, and feel great with no symptoms. You pay for one of these scans just to be safe. You lie in the loud machine for 30 minutes, and a couple of days later you get a thick envelope. Right there on the second page, the radiologist mentions a small lung nodule the size of a pencil eraser, or maybe a kidney cyst, or a small shadow on your liver. The report says, recommend follow-up imaging in 3 to 6 months. How do you feel then? You went in feeling strong, but came out being told something is hiding in your body. You probably cannot think about anything else. Every time you take a deep breath, you wonder about that nodule. Every tiny ache makes you think about that cyst. 3 months later, you go back for another expensive scan. Maybe the spot is still there or slightly bigger. The radiologist isn't sure, so they recommend a specialist, who then recommends a biopsy to be thorough. A biopsy is not nothing. It means heavy anesthesia, sticking a long needle into your organ, and facing real risks of infection and bleeding. Scientific research actually shows that when doctors scan healthy people over 60, they find something unusual in 90 to 95% of them. We all have little spots and shadows. The medical term is incidentalomas, things found entirely by accident. The vast majority will never cause a problem. They are just part of living in a physical body for 7 decades. I call them wrinkles on the inside, but legally we cannot ignore them. And that starts the terrible cascade. Research following people who got whole body scans showed they didn't live any longer or avoid deadly diseases. However, they did have significantly higher rates of severe anxiety, deep depression, and completely unnecessary procedures. The scans didn't make them healthier, they made them sicker. What should you do instead? I am not saying to ignore your health, but to pay attention to the right things. Instead of getting a confusing picture of your insides, focus on how your body actually functions right now. Can you walk up 2 flights of stairs without getting winded? Can you stand from a deep chair without using your hands? How are your balance and sleep? These functional measurements tell me far more about your health than any fancy scan. For a real checkup, find a doctor who will sit and spend time talking with you. Have them review every daily medication, because I guarantee at least one is probably doing more harm than good. Discuss your diet, physical activity, and social connections. Those everyday things determine your health. A functional assessment optimizes your existing good health, whereas a scan looks for problems that might not even exist. Let's move to the second test. This affects many people because it touches our deepest fear as we age. Getting a brain MRI just for minor memory issues. In a common scenario, you might be in your mid-70s and occasionally forget an actor's name or why you walked into the kitchen. This is entirely normal. It happens to everyone as they age. But maybe your adult kids watched Alzheimer's documentaries and are scared, so they push you to get a brain scan. I truly understand that fear. Nobody wants to lose their memory or themselves. But you must understand that getting a brain MRI for mild forgetfulness is almost never helpful and is often deeply harmful. You get the MRI and days later you're sitting with your doctor reading the report. It uses terrifying words like mild cerebral atrophy, white matter lesions, and small vessel disease. I have read these exact words to patients, making it sound like their brain is rapidly deteriorating. The honest truth is those findings are completely normal for someone in their 70s. It is exactly like scanning your skin and being shocked the report mentions wrinkles and age spots. That is simply what bodies look like at 75. The problem is those medical terms sound like a deadly disease. Suddenly you think you have permanent brain damage and that Alzheimer's is right around the corner, even though your memory is perfectly fine for your age. Studies clearly show that over 90% of perfectly healthy people over 75 have completely abnormal brain MRIs. Yet their memory is normal and their thinking is sharp. The pictures simply do not match reality. I've seen patients who manage complex finances and do daily crosswords, yet their MRI looks terrible. Conversely, I've seen people with severe dementia whose MRIs look normal. The picture just doesn't tell us what we think it does. If you are truly worried about memory, there are simple 10-minute office tests. Remembering 3 words, drawing a clock, or counting backward measures how your brain functions right now, not just how it looks on a screen. If those simple tests show a problem, we look for reversible causes. It could be a new blood pressure pill, low vitamin B12, undiagnosed depression, sleep apnea, or a bad thyroid. A good doctor checks those things first. You'd be amazed how often fixing just one brings a person's memory right back to normal without an expensive MRI. We treat the living person, not the printed image. Of course, if someone is getting progressively worse, getting lost in their own neighborhood or unable to manage money, we need a full workup including imaging. But for everyday age-related forgetfulness, an MRI creates far more problems than it solves. The third test surprises people because it seems logical: routine stress tests for your heart. Specifically, putting an older person on a treadmill just because they hit a certain age. Rigid hospital protocols cause huge problems here. Typically, a 72-year-old going in for minor surgery, like a knee replacement, is forced to take a cardiac stress test just because they are over 70. Even if you feel perfectly fine and can walk miles without chest pain, they force you onto a steep treadmill with wires attached to your chest. Think about this. If you walk 2 miles daily without problems, what will a treadmill test tell us that we don't already know? Your daily life is your stress test, and you pass it every day. But protocols dictate you get on the treadmill. This is highly problematic because stress tests have a massive rate of false positives in older adults. The machine flags an issue when nothing is actually wrong, perhaps due to medications or a naturally slower heart rate response, not a dangerous blockage. Once labeled abnormal, you are put on a medical conveyor belt straight to a cardiac catheterization. This highly invasive procedure involves threading a tube up into your heart, carrying real risks of tearing an artery or causing a stroke. Very often they find exactly what you'd expect in a normal 72-year-old heart: mild plaque buildup. They find nothing needing stents or bypass surgery, and nothing about to cause a heart attack. But now you've had a scary procedure and are permanently labeled a heart patient. You're put on heavy medications, and the psychological damage is done. You become terrified to exert yourself, sitting in your chair because you think your heart is fragile. The test meant to protect you has stolen your active life. The alternative: listen to your body. That is the absolute best stress test. If you can climb stairs and do chores without chest pain or excessive shortness of breath, your heart is doing okay. Watch for real symptoms: chest discomfort upon exertion, sudden shortness of breath, or severe dizziness. If you have those, get checked immediately. That is when a stress test makes sense. If you just want to know your future risk without false alarms, use a coronary calcium score. It's a quick 5-minute CT scan using very low radiation that measures the hardened cholesterol in your heart arteries without treadmills or needles. A 0 score means low heart attack risk. A high number means you need to get serious about prevention. Fix your diet, exercise, and perhaps take medication. The key difference is that the calcium score guides prevention without automatically sending you down a terrifying road of invasive procedures. Don't let someone put you on a treadmill just because of your age. Trust what your body tells you every day. Now, the fourth test, which is a bit controversial: routine screening colonoscopies after age 75, assuming your previous ones were normal and you lack special risk factors. Let me be clear. I am not against colonoscopies. I strongly recommend them starting at 45 or 50 to remove polyps before they become cancer. If you are due for one in your 50s, 60s, or early 70s, please get it done. But every medical test is a delicate balance of benefit and risk that changes as we get older. The benefit prevents a slow cancer that takes up to 10 years to cause problems. If you are 80, is that future benefit worth the immediate risks today? Colonoscopies carry real risks that increase with age. First, the intense preparation process can leave an older person severely dehydrated and dangerously weak. Then, the heavy sedation carries a much higher risk of causing prolonged confusion or breathing problems during the procedure. Finally, the big risk: perforation. As we age, the colon wall gets thinner, and the risk of the camera scope tearing right through it roughly doubles or triples after 75. A perforation is a massive surgical emergency. Sometimes a patient wakes up with a lifelong colostomy bag. For an 80-year-old, this severe operation can mean the end of independent living, moving from their own home to a nursing facility forever. Weighing that risk against preventing a cancer that takes years to develop, the math doesn't work if your realistic life expectancy is under 10 years. You are far more likely to be harmed today than saved a decade from now, which is why guidelines suggest stopping routine screening between 75 and 85. This isn't a one-size-fits-all rule. A strong family history, past bad polyps, or inflammatory bowel disease changes the calculation entirely. But for the average person, routine colonoscopies deep into your 80s probably do more harm than good. Instead of ignoring your colon, shift your strategy from invasive screening to smart surveillance. Pay close attention to daily symptoms. Persistent bowel changes, blood in stool, unexplained pain, or sudden weight loss are bright red flags. Age doesn't matter then. You need a colonoscopy immediately. Second, use the massive power of your diet. The single best thing you can do for your colon is eat fiber, fresh fruits, vegetables, beans, and whole grains. Fiber feeds good gut bacteria that protect your colon lining against inflammation and cancer. That is real, zero-risk prevention. The message is simple. Get colonoscopies when they make sense, up through your early 70s. After that, focus on watching for real symptoms and eating the right foods. There you have it. 4 tests causing more harm than good after 60. Whole body scans finding non-problems. Brain MRIs creating abnormal anxiety. Routine treadmill stress tests triggering invasive procedures. And routine colonoscopies after 75, risking far more than they prevent. Notice the clear pattern? It is all about that cascade effect. One test leads to another, then to a dangerous procedure, and finally to a severe complication. Somewhere along that journey, the medical system forgets to ask, is this person actually better off today? True health is not about perfect test results in a folder. Health is about daily function, enjoying grandkids, taking walks, reading, and living without constant fear or unnecessary medical interference. Your goal at 70 or 80 is not just to live longer, but to live better with independence and joy. Sometimes the best way to protect that life is to look a doctor in the eye and say no to a test that sends you down a dark rabbit hole. I am not saying avoid all medical care, but be a smart, empowered patient. Ask your doctor why a test is needed, what happens if they find something small, and if there is a safer alternative. Then, make a firm decision based on what matters most to you. You are the boss of your health, not hospital protocols or computer reminders. The more you understand what you are agreeing to, the better decisions you make. If this was helpful today, please share this video with someone who might benefit. For more honest conversations about health, leave a like and subscribe to Vital After 60. I will keep having these conversations because they matter. Let me know in the comments. Have you ever felt pushed into a medical test that didn't feel right? I read every comment and learn from your experiences. Take care. Remember, sometimes the healthiest thing you can do is nothing at all.